for both groups.
Joining us now with some more insight is Dr. Mark Loafman. He's the chair of family and community medicine at Cook County Health. Doctor, thank you so much for joining us.
Thank you for having me.
First of all, both Pat and I have kids in college. We're scared to death about what's going on. You tell them wear masks, wear masks, wear masks. But what else can you tell them to do to keep this from, spreading? We've already heard so many colleges are shutting down or sending kids home.
It's not like there weren't enough things to worry about already, right? Going sending your kids off to college and you add this whole thing. So we really have a concern as well for our parents. What are we doing? So I think the big three things we hear, and the CDC is telling us and everybody else, watch your distance, wash your hands, and wear a mask. And that's the big thing. Well, it's easy to say that, but then kids are away at school. School, by definition, is a social experiment. It's an experience where kids go off and learn, young people. It's part of the reason we have college campuses. So by definition, they're going to be socializing, interacting, and trying to do that in a new way is indeed challenging. We're telling parents to just reinforce that. So sticking to the basics, watch your distance part. That applies to the dorm. Who are you living with? Who are you staying with? How do you use the bathroom in the facilities? How do you use the meal space? So all of that needs to be considered.
Do you think
wash your hands? It's not just about a few times a day, but it's about all of the surfaces that we touch and come into contact with and being mindful about that. And lastly, the mask part. And we just emphasize this in public health all the time. Wearing masks is like seat belts and condoms and everything else. It has to be consistent to be effective. So getting that used to be consistent. That's a lot to think about while they're trying to study and socialize and doing the other activities. So the last thing we say then is look at the case rate at that campus. And if there's an outbreak, if there's a higher than average case rate, and I think last count there's over 60,000 college students now that have tested positive since this academic year has started nationwide. So there is a lot going on.
Doctor, do you think that some of the issue lies with these kids, that there's an air of invincibility about them? And then when the younger people do get COVID, they're not getting it as badly as perhaps those in an older group or sector. Is that fair to say?
Statistically, they're much more likely to do well. Some don't even have symptoms, but it's certainly not 100%. So we have lost to young people to COVID, and many have gotten quite ill. And they're also the secondary spread. So they come home. Some schools are sending them home when they're sick, which is kind of the opposite of what you would hope would happen. They need to be isolated until they recover. But yeah, I think so. The odds are good. If they get sick, they're going to survive it. But what are the consequences and costs of that spread? Some of that spread is exponential. One person infects three, they infect three more each. Soon you have 100 infections from the one. So that's really why this large congregate living is a concern.
And Doctor, we really, as we get into the darker months, as we get into fall, we really need to try to avoid, as they say, COVID fatigue. We have to remain vigilant, washing hands and staying indoors.
Yeah, so COVID fatigue is a real thing. I mean, we've been at this a while, and we're going to be at it for a while. So part of it, we break it down into sort of the personal, physical self-care, and then also the emotional, mental health self-care that we have. And for the physical, just stay mindful, and sleep is important as always. If we're rested, we're more likely to be resilient and cope. So sleep is important, and having some physical activity, setting a limit, basic activity that you can keep up with on a regular basis, and then diet and nutrition, staying focused on that.
Thank you so much for your time, Dr. Loafman with the Cook County Medical System. We appreciate it. We'll be in touch.
Be safe, be well.
Thank you for having me.